Flu, or otherwise known as influenza, is caused by a virus called the influenza virus. Now, there are different types of influenza virus, namely influenza A and influenza B. I'm sure you are aware of the influenza A H1N1, and recently many people fear about this particular H1N1 virus. The signs and symptoms of influenza infection include namely fever, cough, shortness of breath, chest pains, and sometimes people may also have abdominal pain and diarrhea and headache. For most people, this infection is a very self-limiting disease, meaning to say people have fever and cough for about 3 to 7 days, and after that they get better by themselves. However, there are people who get severe disease that may require admission. Currently, there's an outbreak of influenza worldwide, including Malaysia and also Sabah. There are more and more cases of people coming in with symptoms that I mentioned just now, and after doing tests for influenza, they are found to have influenza. Many of these patients may just need symptomatic treatment and they get better uneventfully. However, there are a few patients who develop severe symptoms such as shortness of breath requiring oxygen. These patients need to be admitted. Who are the patients who are at high risk of developing severe influenza and complications? These people include the elderly, those who are more than 60 years of age, those people who have comorbidities or other diseases such as diabetes, hypertension, heart disease, kidney disease, liver disease, or any other disease, people who are on drugs that suppress the immune system, young children, and also people who are working in the healthcare sector. The patients are placed in a single room. Visitors are advised to wear masks. There is a very strict hand hygiene implemented in the hospital, and this markedly reduces the risk of other people in the hospital, including visitors and other patients, from getting infected with the virus. Secondly, we treat the patients with a drug called oseltamivir, or otherwise known as Tamiflu, for the influenza virus. Occasionally, patients with influenza may develop a secondary bacterial infection causing severe pneumonia. These patients may be given antibiotics. Very rarely and unfortunately, there are some patients who develop very severe pneumonia and in severe respiratory distress. These patients may need to be treated in the intensive care unit. Very, very rarely, unfortunately, there are also patients who, despite the best of treatment, or patients who come in late who actually die of this disease. So while this disease usually does not cause death, it can cause death in a very small minority of patients. It is therefore very important, if any one of you have signs and symptoms of influenza, and if you are in the high-risk category, or if your family is in the high-risk category, you should bring them to a hospital for assessment and diagnosis. If you have symptoms of influenza, such as fever, cough, you should present yourself to the nearest healthcare facility to be seen and managed by a doctor. If a patient or someone you know has very severe illnesses, namely severe shortness of breath and very ill, you should present yourself immediately to a tertiary hospital with expertise and facilities in infectious diseases, respiratory medicine, and intensive care. It is very important that these patients are treated comprehensively and aggressively. How do you prevent yourself from getting influenza? There's no way of preventing 100% from getting influenza. However, we can reduce our chances of getting influenza. The number one way is to be vaccinated for influenza as soon as possible, especially so for people who are in the high-risk category. There are other ways that are important also, which is to make sure that you practice proper hand hygiene. Always wash your hands with soap. Wear a mask if you're at places or near a person with suspected influenza. If you have influenza or suspected influenza, you should not go to work. You should take leave to prevent yourself from spreading the disease to other people. In summary, I would like to say that while influenza can potentially be very serious, it is a very highly treatable disease if you present yourself for treatment